Catherine de Fontenay, Commissioner at the Productivity Commission.
Thanks, Catherine. It's great to see you here at Digital Health Festival. I feel like we kind of bump into each other at all the different things around and about. What brings you to Digital Health Festival?
I'm speaking on a panel about what digital technologies can do in the prevention space.
Excellent. When I've seen you up on stage in the past and in our conversations, I know the Productivity Commission has increasingly been more involved in the discussion around healthcare technology when I probably hadn't seen that in the past. Explain to me why that's the case.
Oh, excellent question. We've decided to stand up a permanent research team in health because it's such an important space. It's a space where it was hard to measure the productivity of what was happening in health, so we didn't know if we were doing a good job. If we measure productivity in terms of quality of life and life expectancy, then we want to know if we're doing a good job. And we wanted to know what the potential was for things to go better. So we did a paper last year on measuring productivity in healthcare and found that actually, whereas productivity in the regular market economy is pretty anemic, we were going gangbusters in health. We were delivering productivity growth of about 3% a year. That sounds small, but that's pretty amazing.
Okay. What does that mean, productivity growth? Like, what's the measure to say, hey, we're more productive?
So what we did is we took the data on what we spend on people with specific conditions. We could do this for about a third of all health conditions. So cardiovascular disease, most types of cancer, and blood diseases and endocrine diseases. And then we looked at what happened to people's life expectancy and what happened to their quality of life with the disease. And what we found was that from about 2011 to 2018, life expectancy had improved amazingly. Quality of life while you have the disease, not as much, so there's still lots of potential to improve there.
When you say that, Catherine, I think about, look, that's, it's almost like, oh, cool, like here in healthcare, we're, you know, a step above the rest of the economy and all that. But then I think back and I'm like, the amount of conversations we have in the ecosystem about how we need to do more with less and we need to be doing better. And we talk about burnout. We talk about all the issues in healthcare, the cost and the inequities. And so that doesn't marry up what you're saying. So why is there that separate? Should we be trying to be more productive if it's not even doing this, if you know what I mean?
Look, we should absolutely be trying to be productive, but the productivity gains we've had have been in terms of better quality outcomes from our health system. What we haven't addressed is the cost of our health system, and that we really have to address.
Yeah.
So we can't keep spending more and more of our GDP on health. Meanwhile, we're facing an aging population, a population with more complex conditions. We have to do something to deliver their care more efficiently. And that's why I'm super excited about digital technologies. And we also wrote a paper on digital technology in healthcare, because we think that for the first time in ages, we have some technologies on the table that could really be game changers in terms of delivering not just better healthcare outcomes, but much cheaper healthcare outcomes. So if we can send people home from hospitals sooner, if we can save a lot of healthcare workers' time with AI, then we're going to be able to help with burnout. We're going to be able to help with ramping, with all of those backlog problems that we're all stressed about.
What I like too is that, you know, we've got you here sharing these insights, Catherine, at Digital Health Festival, which is such a bringing together of the ecosystem. I know you've been very active in sharing some of this with different parts of healthcare. I think about, you know, we've got the startups down in Startup Alley there, and there's clinicians out on the floor too. Sometimes it might feel a little bit like nebulous of like, well, the Productivity Commission is over here, or here's like some insights. Is that how we should engage with the productivity? Like, we wait for stuff to come out, or like what should people do now that we've got this information? What should we do about it, type thing? Yeah.
Well, I think that this health community should tell us what they think the problems are and what needs to be done to fix it, because then we'll produce better research. But now that we have this information, I think that we need to move a little faster, pushing digital technology out into the sector. For instance, we know that remote patient monitoring, sort of sending a patient home early with equipment to monitor their blood pressure, their heart rate, their insulin, can hugely reduce the risk of readmission to hospital. We know that using AI like scribe tools and just better patient management can save about a third of healthcare worker time. Imagine giving every healthcare worker back 11 hours of their week.
Mm,
That seems pretty damn appealing.
yeah, sure.
And, in a world where they are tired and overworked and burned out, don't we want to give them 11 hours a week?
Yeah. Lastly, Catherine, you mentioned the scribes, the emerging tools, the innovation. We, on one hand, on paper, that sounds great, but then you bring in all these other complexities around safety, security, uncertainty, and risk, and everything in emerging technologies. Where do you see the role of artificial intelligence and emerging technologies, or the risk versus reward piece come in?
Yeah, look, I think the evidence so far suggests that the rewards really outweigh the risks. And I think sometimes we measure the risks against an artificial benchmark. So when we look at a scribe tool, we want that scribe tool to have 0 errors. We don't say, what is the error rate compared
Yes.
to a human writing this down in unintelligible doctor handwriting? What's the risk that the next person can't read that information? What's the risk of a patient going to a consultation, being told they have cancer, and then not hearing anything from the next 45 minutes of their consultation? So what we want to do is we want to balance the risks of AI, and we want to keep checking how it's performing, and that's a good role for the TGA and other regulators. But we do want to balance that against the risks of the alternative.